Let's go. There you go. Hey guys, this is Stephanie Fish with your Norton Sports Health Kentucky Derby Festival mini and marathon training program. And this is another one of our Tuesday talks that we like to do for you guys to make sure you stay on track, stay healthy, and stay informed. So I'm here with Elliot Mattingly from KORT Physical Therapy. We'll be talking with him today about aches, pains, possible injuries, maybe where they're coming from, the aches and pains, the strengthening, the stretching side of things. Just kind of touching on a couple little topics today to keep you running and kind of work through some of those minor aches and pains you might be feeling along the way. We are more than halfway through our training, so you might be feeling it. Couple little housekeeping tips. None of you guys are on camera. And all of you guys are muted, so no worries there if you're at home in your pajamas or eating your lunch. And the biggest thing today we want you to take advantage of is the Q&A feature. So on the bottom of your Zoom screen is a little box that says Q&A, and we want you to put your questions in there. This is the time to get your questions answered live. We are live, and we're going to answer them today to the best of our ability. It doesn't matter what the question is. Doesn't matter what you want to ask about, just throw it in there and we will do our best to address it today. This is a very good resource with KORT Physical Therapy today, and we just want to really take advantage of it. And then again, as usual, we will be sharing this video in the Facebook group after we are finished later today. So let's kick things off. Again, Elliot Mattingly with KORT Physical Therapy. You may have seen him at some of our group training runs, him and his dog. And or kid or wife or whoever you may bring that day. So thank you for coming. How is your training going?
It's going good. Actually, about 3 weeks ago, I did a mini in Greenville, South Carolina that went better than expected because I probably wasn't as trained for that. But so exceeded expectations there to hopefully set up a successful Derby mini. And actually, I'm doing a mini the week before too, so I'm kind of doubling down. Wow. We're going down to Waco. We have another baby on the way, so this is our baby moon. Okay. So yeah, that's pretty exciting. So my wife's going to do that. She'll be 7 months pregnant. So she is the superstar on that one. And in the last one, she pushed our daughter in a stroller for 13 miles. And once again, so she was probably 5.5 months pregnant at that point. So wow. Yeah. Okay. So she's a beast. Well, yeah.
Stroller moms pass me all the time in races. So go moms. Yeah. All right. So let's go ahead and get talking here. So again, real quick, Q&A feature on the bottom. Throw those questions out there as we go. You don't have to wait until the end. As soon as it comes to your mind, go ahead and put it down there. We're going to run through a couple of things. So you're welcome to ask your questions during that time. So today we are going to cover what?
We're going to cover just what it looks like from a general physical therapy exam. I think a lot of times, what you've seen from us at KORT is we have so many things to offer, whether it's dry needling, the Alter-G, Dorsa-V, all these different specialties and really specific type treatments. But sometimes we forget about what we do on a day-to-day basis. And that's just our basic evaluation, which can really bring a lot of skill and bring a lot of information to you to help keep you running. So today, one of the things that I always like to talk about in runners, runners that come in with knee pain or back pain or even foot pain, is they talk about their chronic tightness, or they're like, Elliot, I stretch my hamstrings every day, and I stretch them before and after I run, and they're always tight. And one of the things that we see is that it's not necessarily a tightness issue, it's a strength issue. So that's today what we're going to do is just kind of walk through what that looks like, to look at your hip range of motion, some of your knee range of motion, and then your flexibility, and talk about the difference between a stretch tightness and a strength tightness. So hopefully we can answer your questions, but I see we do have a question already. So before we do that, let's go jump on.
Am I go ahead and answer a question? Yeah,
absolutely.
Let's see what we got here. Read it out there.
3 weeks ago, I did a stretch that pulled my left quad and groin. Still painful to run on. Advice on what to do. This is perfect. So
answering that live.
Yeah, thank you, Shannon. So what we're going to do is actually let's change gears and let's look at that. Okay, so I'm going to show you what we're going to look at with Stephanie, and then this can be how you could check that out for yourself and have go see one of our therapists, and they can offer you a screen and try to help you figure out the solution. Or we have therapists coming to tonight's training run, and then really at all the training runs there's going to be somebody there. So that's another opportunity where they can actually get their hands on you to figure it out. So let's try to figure this out. So we have tightness in our quad and a groin strain. So the thing we have to look for, is this a quad problem or muscle problem? Is it a hip problem? Or is it a back problem? Because a lot of times our back can actually refer pain to our quads, and our hip muscles, our psoas, actually attaches to our low back. So if we have stiffness in our low back and that psoas or the hip flexor is working really hard, it's going to feel really tight and uncomfortable. But if you don't address your back, that's going to continue to stay that way. So you cool to check that out?
Oh, boy, you're gonna uncover some aches and pains.
Oh, no.
I definitely have them, folks, so no judgment here, all right?
All right, so
This way?
yeah, go ahead and lay on your back there for me, please.
Okay. I think I'm on the opposite side.
That's okay.
Okay,
That's all right. So a lot of times when people think about a PT evaluation, they associate physical therapy with pain. But really what we want to do is we want to look at differences within your body. So if we notice there's a range of motion deficit one side versus the other, or a strength deficit one side or the other, that's what really lets us hone in onto what is creating the pain and the problem, and not so much like we don't have to create pain during the evaluation. So when I would go through and look for your hip, the first thing I would do is I would look at your joint range of motion. So this is called hip flexion. And what I look for is, when do I find a point where it becomes a little stiff or rigid? And we all know Stephanie does yoga. She's really mobile. So she goes through really smoothly. What you might see when you have hip pain is you get a little stuck right in here. And that can still be from a couple different things. That could be from your hip or your low back. So then we go through and we look at hip internal rotation. So I'm going to take her foot and turn it to the outside. And that one can usually bring on a little bit of discomfort in that hip and help us hone in a little bit more to see if this is a muscle problem or a joint or a back problem. So that looks really good for her there. The next thing I want to do is, even though she's coming in and talking about being Shannon, talking about her quad and her hip, I'm still going to look at the flexibility of the backside of her leg, because that can tell me a few things. It looks at her hamstring mobility, her calf mobility, but really it looks at that sciatic nerve. And if our back's a little ticked off or that nerve's a little angry, we're not going to be as mobile one side versus the other, and it just might feel a little uncomfortable. So I'm going to bring her leg up here and start, see when I feel tightness. So for normal, it's about 80 degrees, right? So we know, once again, that she's really mobile, but even though she's really mobile, we got to compare sides, because if she can go really far this way, and then I get the other side and it only goes to what is considered everybody else's normal, then that's not normal for her, and we want to address that. So let's say we go through and she feels really tight right in here. I have to figure out if this is a hamstring tightness, or calf tightness, or a nerve tightness. So what I'll do is I'm going to put a little pressure on her foot. And if she's like, oh my gosh, that really makes my stretch worse than my hamstring. Well, I didn't move her hamstring. I moved her toe. And the only thing that connects her hamstring to her toe is that sciatic nerve. So we know, we can tell right away if somebody's tightness is a nerve tightness versus a hamstring tightness. And typically when it's a nerve tightness, we know you can stretch it all you want and it's not going to change. What we have to do is we have to figure out, if we get it stronger, will it change? Or if we address the stiffness in your back, will that change? So that's probably one of the most common things that we see in therapy, is people will come in with these chronic issues that they've been treating, like their knee or treating their foot, but they don't really get to treat the other piece of that puzzle, which is our low back and the nervous system that plays a role.
Yeah.
So Shannon, that would give you at least a little bit of piece of information on what your problem is, because that's the first thing you have to do before you go into a treatment, is figure out what the problem is. So the next thing I would do for you is look at your flexibility of your quadricep. So I'm going to flip on your stomach. And so just for viewing sake, I'm going to switch sides to this knee here. So I'm going to do a test that actually looks at the flexibility of your quad. And I'm going to bring her foot, and I want to try to see how close I can get her foot to her hip. And so she can make contact. Once again, I'm going to look at both sides. And she is a little stiffer on this side, but still nothing really alarming. But for Shannon, if you go through and that brings on your symptom, then that is going to be a good test that you can like do over and over to make sure you're getting better. The next thing I would do is I would actually go through and start feeling on her low back to try to find any areas of stiffness. So yeah. And she felt that right now, and I'm pushing really lightly.
Yeah, I know.
So the fact that she feels that tells me there's some dysfunction there. It doesn't tell me a ton of information yet, but at least says, hey, this is something that we want to go through and evaluate deeper and potentially treat. And now that can help offloader symptoms here. Because once again, we think about the quadricep is controlled by some of the nerves that come out of our low back. The psoas or the hip flexor attaches to our low back. So if this has some dysfunction, that's going to change the way everything else moves. So Shannon, I hope that gives you a little bit. I know we got some more questions, so I want to jump on those if we can. And Shannon, once again, you reach out and you ask any of our volunteers that are going to be at the training runs, and we'll be glad to help you. Let's see. From Denise, I have some right hip pain. I've been foam rolling, Epsom salt bath, and massage ball. Seems to be helping. Do I have any other suggestions? Well, I'm glad it's getting better. That's great. And what I like about that is you're doing an active recovery. So you're trying to work on the mobility and really, I think the missing piece is probably going to be strength, because you're doing a lot for the soft tissue to improve your flexibility. But if we don't address the strength that maybe led to some of that dysfunction, you'll have a tendency to fall right back into that. So we'll just segue straight into that.
Okay.
So when we look at strength, there's a few things we look at. We look kind of globally, but with runners, it's really particular to look at the strength of your hips and the strength of your abdominals. And we do just a couple of really simple tests. And once again, we just look for a different side to side. So when you're talking about hip pain, hip is pretty loose for, you have a lot of different glute muscles and deep muscles like your piriformis and all these different little rotator muscles in there. So it's kind of hard to determine what's going to be the root of that soft tissue problem. But if your big muscles don't have the strength they need to, then we need to clean those up and make that stronger to offload some of those little muscles that may be causing that pain. So we're going to check her hip extension first. So you're going to keep this leg straight, and I want you to lift it straight up off the table for me. Okay, and then I'm going to give her a press down, hold nice and strong. That's really good. Let's do this side. Same thing, lift up, hold strong. Good. This one I'm able to push a little bit more. And if you see her right shoulder's popping up just a little bit. So really what that tells me that it's probably not a hip strength problem. I bet we're going to look and we might see a control issue with her abs. That's something we see a lot of times, especially in people that are really flexible and mobile.
Or my lack of abs, I should say.
They're there. We just got to get them. They're like, she is so mobile and flexible that her abs actually have to work for a greater surface area and a little bit more range of motion than somebody stiff like myself. So I have to control this much motion. She's got to control this much motion. So let's check your hip abductors. So this is like your glute medius and minimus. If you read a lot of these running articles, you'll see some of those pop up. So I just wanted to let you know what those were. So go ahead and face the camera, laying on your side for me. Straight. Okay, I want you to hold right there for me. The first thing I do is, can she hold the position? And she does. She holds really well. And she's not really putting a lot of weight on her hand. I'll see patients just, bam, they'll just grab the table and hold on for dear life. So hold that. I'm going to push you down. Ready?
Okay.
Hold strong. Good. That's pretty good. Let's go to the other side.
Okay. I'll face the camera just so you guys don't get a butt shot. That happens a lot unintentionally.
Okay. Hold right there.
Okay.
Don't move you. Yeah, so she's pretty strong in both. Like I could push her a little bit, but she doesn't give. If somebody comes into the clinic and I ask them to hold the position and their leg moves forward or they roll backwards, or if their leg just drops a little bit, then we know we have a significant control issue here. It's good that we figured that out. Right. So
and that's more stemming from the glutes, right?
Yeah. So that's in good shape. And now another thing we look at too, if I bring you in this position and it's a little weaker and I'm thinking, you know what, I bet it's not a glute problem. I bet it's an ab problem. What I'll have somebody do is I'll actually let them cheat. I'll let her roll forward, hold on to the table and hold your leg there. And she's going to see how much easier that is. But what we're doing is you're taking your abdominals and your core and you're twisting it. You can let this down. Oh. You're twisting it. And just like, if you take a dish rag and you let it hang loose, it's not very, very tight. But if you go through and you twist it, you're not changing the length or any of the tension, but all of a sudden it just gets really rigid. And that's what sometimes we try to do in life is we try to use our body to rotate. You'll see this a ton with runners is they'll rotate their bodies to try to create stability. So those people that you see, if like looks like they're throwing elbows at you, they lack some abdominal strength. So they're trying to figure out how to create stability in their body, and they're using that motion to do that.
Oh, while they're running?
Yeah.
Oh yeah, I call that chicken running.
Yeah.
That's you guys that run like this with your elbows out.
They're out there, that's for sure.
I call that chicken running. So So we want, so the main points from that was strengthening the glutes.
Yes.
And the glutes are not just the back of your butt. It's not just your butt that sticks out. It's the sides.
Absolutely,
The,
yeah.
like you said, the medius and the
Yeah, so there's the minimus and the medius.
Yeah.
And then there's the maximus, and we all heard
Yeah.
the max, yeah.
max is the
Yeah,
back.
yeah, the big house.
Yeah.
You know, that's what my old professors called it back in the day.
So ways to strengthen
Yeah,
those areas.
that sounds perfect. Let's do it. So, actually, we haven't checked your abdominals yet, either, so let's do that.
Yikes.
She almost got out of that.
Yikes.
So go ahead and lay on your back.
Okay.
And really, when we do this test, it's not meant to like look down on somebody or to really find fault. We try to get really specific to figure out, are there simple exercises you can do to get better?
Yeah.
Okay. So the first thing we do is we usually take your abdominals and we split them into two groups. You have your movers and your stabilizers. So your movers are like, it's your six-pack muscles, right? So that's what flexes you and helps you do a crunch. So that's what we do for the test. So you put your arms out straight. I want you to start with your head and do a slow curl up for me. Good. Back down. So what I'm looking for on this, does she move up slow? Does she curl up like I asked her to? Do her feet raise up? And none of that happened. That was pretty good. So now you cross your arms and do the same thing. Good. Back down. And last one goes hand behind your ears.
Without pulling my head?
Yes.
Dang it.
Yeah.
That was a little harder.
But so here's the thing though, like if I have somebody coming in and that is how close they are.
Yeah.
That's probably not our main problem, right? You know, so that's pretty good. Like, that's better than I can do, and that's better than most people that come in and see.
Cool.
So.
A plus.
Yeah, that's
Yay.
right. Well, A minus, I guess, but still an A, yeah,
Darn it.
yeah, darn. So the next thing we'll do is we're gonna look at your stabilizers. So our stabilizers are made up of quite a few different ones, and, you know, so this is, because even some of the other abs still move you, but like when your obliques work together, they're a stabilizing muscle, and you have some deep abdominal muscles that work to do this too. But I'll have you cross your arms for me. And I'm gonna bring our legs up into this 90-degree position. I know some of you are probably like, well, I can't even get in the test position. You get as close as you can. And the first thing I do is have her hold it. So hold that there. And this is gonna be really easy for her because she's so mobile. But what we look at next is I wanna see if she can maintain a flat back and then let her legs drop a little bit. Yeah, you see how you wanted to pop up already?
Yeah.
Yeah.
So I'm trying to push my back
Yeah.
into the table.
That's good. You know, so once again, if you were coming in the clinic and this test and the other test looked like this, we're not going to work on your abs that much. You can do some of that on your own. It's always good to build your strength, but that wouldn't be your primary issue.
Yeah.
Yeah. So good. So now let's talk about strengthening.
Okay.
Unless anybody, I'm not sure if anybody else has a question. But let's go ahead and work on some strength.
Okay.
So I'm gonna have you bend your legs for me. So some of my favorite exercises to do are just exercises that make your muscles turn on. So it doesn't, a lot of times when we run, our body gets into a pattern where like our quads are working really hard, maybe our calves are working really hard, but typically our glutes can fall to the wayside.
They just hang back.
They just hang back, you know?
Yep.
So that's why sometimes people will be like, if you're running, take your butt with you,
Yep.
you know, to make sure you squeeze your butt. But an exercise I love is I'll take a belt and I'll put it around somebody's legs. So not a resistance band, because really our glutes are strong. And most resistance bands that you're going to have or get in a store, you're going to be able to blow right past it and really you won't get the major gains. So when you have something that blocks your movement, you can actually put a maximal contraction and see the benefits of it. So this is called an isometric contraction. So that just means you push and it doesn't go anywhere. So for today, I'll show Stephanie like with my hands. So push against my hands here, hard as you can, hard as you can, hard as you can, hard as you can. And then you feel them tighten up, right?
Yeah, on the outside.
Yeah, perfect. So this is going to hit your glute max, so your big muscle, because not only does that extend, that rotates your knees, but also you get a little bit of our side hip muscles too. So I like doing that. I'll hold for 2 or 3 seconds and do 15 to 20 of those. And what you're going to feel is when you get up is your legs will actually feel lighter. So for both you all who commented so far, that's a good way to start it, because if your glutes get activated, does that change the pressure of your hip muscles or change the pressure of your quad tightness? Because it really can. You might do that and feel great, and then all of a sudden this becomes your warm up.
Yeah,
Yeah,
yeah, that's what I was going to say. These are great warm-up exercises that we're going to run through before you run. And I realize it's laying on the ground and everything. So this might be when you're home before a
Mhm.
run. So we're gonna activate the muscles that we want to try to use during the run.
Yeah. And you know, and some people are like, what if I get sore from these exercises? Well, you might, most likely you won't get sore. But if you're sore in your hips and then you go for a run, you can tell when you're using the muscles or not.
Yes.
So it's actually kind of nice to be
Yeah.
sore and go run. Because
I
you
like
can
it when
feel
my butt's sore when I go for a run. I'm like, oh, I'm using my
I'm
butt.
using it.
I'm
Yeah.
using my
That's
butt.
exciting.
Yes.
So I like that one to turn on your hips.
Okay.
And even though we wouldn't really need to work on your abs, I'm still going to show everybody, because I like the same kind of thing. I like to create stability or create a full contraction with your abs. And what we'll do is I usually take like a stability ball,
Okay.
or like a yoga ball or whatever you call it. And then what you're going to do is you're going to put your hands on your thighs, and all you're going to do is you're going to push into it and breathe out. Yeah, so that breathing is important, believe it or not.
I was holding my breath.
If you have struggle running and you're not breathing, then I bet if you breathe, it'll be better. No. So with these exercises, if you hold your breath, and a lot of times if your body will make you want to do that.
Yeah.
That means your abs aren't working the way they should, because your abs and your diaphragm should work together. So you should be able to contract your abs and breathe through your diaphragm like really easily, but like your body says, hey, turn that off. I'm gonna hold my breath. But what that does, that creates this internal air pressure and pushes out against your abdominals when we want to create this external pressure coming in. So you just hold for a couple seconds, then she relaxes. But on a ball, it's a lot easier because you actually get like a little pushback on it. You'll get a pressure and then you can release. If you don't have a ball, a couch cushion works, a pillow works, something that has a little bit of give. Or if your arms are long enough, you can reach your legs like I could and you can.
Yeah.
Yeah. Another thing that you can do, if you test poorly on the curl up, is you can do a controlled curl up in this same position. So put your hands on your legs, and then you just slide up to your knees, but you're going to start the motion with your head. And it's a slow motion crunch, and that's all you got to go.
I was gonna say, I don't have to go all the way up, do I?
No,
Jeez.
no. And I like this because it makes that first little bit do it really correctly. What happens if we start going up a little bit further, our hip flexors want to jump in and help us.
Yeah.
And that's when your legs raise up, or if you see people like doing sit-ups and like holding somebody's feet, they're activating their hips to help. And really, we want this to be an only abdominal exercise.
We used to hold each other's feet in elementary gym class. I remember that.
Oh, I used to tuck them under a couch, and I'd be
Yeah.
hammering out sit-ups, but I was doing all hips. I didn't know any better at that point in my life. But yeah, so that's really some good starter exercises you could do to offload some of these issues you may be having. But really, I'm glad you guys asked the questions you did, because those are going to be great for strengthening and offloading some of the stiffness that comes along with that. So,
Oh, sorry, guys, moving the camera.
yeah.
All
So,
right.
yeah.
Well, anything else you want to cover? I know, alarm.
Yeah. So,
We talked about some strengthening. So when they come in and people say, this hurts, and like my quad hurts, my right hip hurts, that might not be the source of the reasoning for that pain. That's what you're trying to get at here.
yeah, that's right. Usually when we have a pain, we think of that as the symptom. It's probably not the cause.
Right.
So that's why self-diagnosis is so hard. And we do it as therapists too. We're all active and we like to do things and run and this and that, but we still, when we have an issue, it is so much easier and really smarter for us to step back, go to a colleague and say, okay, help me figure this out. Because I really remember a vivid story when I first started running and picking up my mileage. I started having some knee pain on the outside, and I started treating it like IT band problems.
Yep.
So I was getting scraped, I was rolling, I was doing all kinds of different things here because I was like, you know what, I'm a PT. I treat this all the time.
Well, people say,
Yeah.
oh, it's my IT band. People say it all the time. They want to just go straight to the general, oh, it must be my IT band. Not everything's your IT band.
No. So I remember I was in our residency program. Gosh, this has been some years ago, but we went through and we did that test. I took you in that straight leg raise to look at hamstring flexibility. Well, when we did that, my hamstring didn't hurt, but it still felt like somebody took like a hot poker and put it into my knee. So at that point I was like, okay, well, I don't have an IT band problem. I have a back problem.
Right.
So that has been something that I've had to work on, and I had to work on. So that little part first by improving my range of motion and strength and flexibility. And then I had to go through and figure out, was my run some of the issues that caused it or what it might be. But really, and what I was doing, I was trying to work on heart rate training. And I was slowing my cadence down, slowing my speed down significantly. And my cadence was running in the 150s, and that's just steps per minute. And then after that, like I got this is when I really got into like learning more about treating runners and things selfishly, but it worked out because I love treating runners. And then I found out that slow cadence was probably my initial downfall.
Yep.
Because I was really just hammering my leg and
Pounding.
oh my gosh. So, and now because I'm tall too, so I was like, I'm gonna reach out and stride out. Well, it was all incorrect.
Yep.
And then
And then you're heel striking.
oh my gosh. And it was like big time out in front of me, heel strike. So long story to say, it's okay to seek help.
Yeah.
It's really hard to self-diagnose, and your problem might be really simple.
Yeah.
You know?
And I mean, these simple things, like this is like a general treatment that you might come into KORT Physical Therapy for. Like we went through a big part of it that
Yeah.
you would start with. Okay, what's hurting? Okay, well, that's not really the cause. Let's find out what the real cause is,
Right.
the real problem is here. So running through those simple things, and then, Elliot or one of the other physical therapists giving you simple at-home exercises, it's going to help alleviate that pain. So this is why we're here. We wanted to show you kind of what they may do if you come see them. They're not sticking you with needles. They're not putting you on a machine. Like, it's simple things just to test it out. It does look like we have another
Yeah.
Q&A. If you want to
That's
check
great.
that out while we're still live, put your
Yeah.
questions down there, guys.
Okay, so let's see, I was late. Did anyone ask about knee soreness, ice versus heat?
Yeah, that's a great question. And really, I don't have a great answer because when you have an injury, like an acute injury, it is ice is better. But once you get past that 10-day mark, it really goes to whatever you like better.
Oh,
so
really?
like,
Oh,
yeah.
I've always done heat. Okay.
Yeah, and
So it
that-
just
that's-
warms it up.
Yeah, that's maybe what you like better. So, yeah, that's a great question. And so when it comes to a point where you've been having this issue for a while, do whatever makes you feel better. And that's the right answer. Because physiologically, neither one of them is doing that much to make a difference. It's the other pieces, the strength and making sure you have your motion. That is going to take care of your knee soreness because it's in a preventative standpoint versus a reactive standpoint.
Yeah. And also, if that does continue, you might want to come in and see somebody.
Yeah. Yeah.
Do we have another one, or?
Yeah. So will therapists tonight's event be able to do a full evaluation or only partial? So in a setting like that, typically we will do a screen and set you up because like at the Norton facility, I don't think we have tables and so we wouldn't be able to do a really great thorough eval like you would deserve. But the clinicians that are there tonight can help you get set up to do that. And because we wouldn't have all of our tools either. So let's say if, Shannon, if you really did need dry needling and you're like, you know what, I want to try it because I've heard it is good for runners. Well, we can't do that at the Norton facility. So, but you can definitely have somebody look at you and do kind of what I did today with Stephanie and get an idea of what can help and try some of that out. You just might not be able to do the full gamut of what we have to offer.
Yeah, try some of those at-home tests, and we can kind of see what you're working with there. All right, guys. Well, it looks like we've answered all of our questions live. So on that note, talking about tonight, we do have a training run tonight. It is at the Norton Healthcare Sports and Learning Center. It's always a big, long title with us. And that is the indoor track. So we are inside today. I understand it's a beautiful night. You guys might want to take your run outside tonight, and that's fine. But we are going to try some 400 or 200 meter repeats, depending on how you're feeling. And your mileage is still ramping up this week. Last week was a recovery week. So tonight we meet, and then Saturday is an on your own training, or possibly you are running the Triple Crown 10K, which is this Saturday, the 19th. And then also on that note, we do have actually 3 Tuesday talks in a row. So this is one of 3. Next week, we are discussing pelvic health for females with KORT Pelvic Health Therapists. So make sure the females join in on that. And then on March 29th, we are getting you ready for your upcoming longest training run, which is just around the corner, folks. We're going to talk about the long run approach and proper taper techniques after that long run with Norton Sports Health orthopedic specialist, Dr. Robin Curry. She's a big fan of the Derby Marathon, and she's been a part of it for a long, long time. So she's a great resource. And again, if you're dealing with anything, she would also be a live resource to answer some questions. So I hope to see you all tonight at the Norton Healthcare Sports and Learning Center at 6 p.m. for our track work. So it's a beautiful night. I hope to see you all there. And thank you, Elliot, for joining us. Guys, get into KORT Physical Therapy if you're having some issues, and we will see you all next time. Thank you so much.
Thank you all.